Hello everyone, welcome to this series of podcasts, I and You, where we discuss everything about ophthalmology and life, and we get to know the person behind the ophthalmologist. So just as a perspective, so when you came back from the United States and you wanted to start your own center, or you had this image of center for sight in your mind. So what exactly was cataract surgery then, and how did your stepping into, how did that transform? So if let me rephrase, what exactly is phacoemulsification, which is thrown around a lot. Not lots of people understand what is phacoemulsification.
Well, for a person to understand, let's first, rather than talk about phacoemulsification, let's understand what is cataract. So, if you look at cataract, essentially, if you look at the eye, if this is the model of the eye, you can actually see that the light comes from here. This is the cornea, and then this is a clear lens which is placed here. So this clear lens, every one of us has a clear lens. So the light goes through the cornea, goes through the lens and comes onto focus at the retina. Now, if this lens, instead of being transparent, as you can see, if it becomes clouded, like it becomes opaque, then what will happen? The light which is going through the cornea gets stuck here, it does not reach the retina. Now, in the absence of any known medical cure, there are some people who claim that there are medical cures, which is not there. What is done is that this cataract has to be removed and has to be replaced by an artificial clear lens. So exactly from the same place where the cataract is removed, you are putting an artificial clear lens. So this is basically the technique of cataract surgery, that you are removing a crowded lens and replacing it by an artificial lens. Now, thank you. Now, when you are replacing it by an artificial lens, the lens obviously helps refocus the light onto the retina.